allow me to focus with this health issue. As you mentioned, it is the pandemic COVID, definitely. And also, at the same time, Komnas conducted a survey on the public perception about health service, which is relevant to be shared here. And we also finalize the standard of norms and regulatory, which also mentioned by Pa Eko in the earlier presentation. And actually, we are finishing also the standard norm and regulatory of human rights defenders, which I will share a little bit. So allow me to share the screen. In this very stressful and sad situation, I should make a presentation that is more optimistic because otherwise we will all be overburdened with the sadness and frustration. So my presentation titled is Toward Fulfillment, the Right to the Highest Attainable Standard of Health in Indonesia. I would like to start with Pancasila. It was mentioned, elaborated by Chair Taufan this morning. And I would just took two of the 5 principles, which is a just and civilized humanity and social justice for all Indonesians. So from the beginning, the founder women and founder, mother, and fathers of Indonesia already stated the importance to have social justice for all Indonesian people and a just and civilized humanity. So I think it is very interesting to look again to these principles in this situation. Secondly, the Republic of Indonesia Constitution adopted human rights principles in 2000 in the Second Amendment, which include Article 28H.1, which stated that every person shall have the right to live in physical and spiritual prosperity, to have a home and to enjoy a good and healthy environment, and shall have the right to obtain medical services. So if medical service is a constitutional right. And the last one, I would like to look at the right to health is the right to the enjoyment of the highest attainable standard of physical and mental health. The UN Committee on Economic, Social, and Cultural Rights has stated that health is a fundamental human right, indispensable for the exercise of other human rights. We can't work, we can't enjoy other things when we are not healthy. So my presentation will include the first one will be introduction, and second is about the realities, and the third will be the human rights standards of norms and regulatory, and the fourth will be the conclusion. So let me start with the introduction. In 2017, I think Madam Katia was already in Bangkok. Indonesia enjoyed the visit of UN Special Rapporteur for Right to Health, Dr. Dainius Puras. And in his back to office report, the first statement was Indonesia is on the right track to develop an equitable and sustainable healthcare system based on universal health coverage. And at the end of his first official visit, it was released to the media. However, he warned, ambitious goals can be reached only if challenges are addressed. So this is a important message, and I hope you will have the chance to look the complete statement in the UN website. The other things, We recognize private sectors have important roles in health issues, ranging from providing health services, producing medical goods, and also trading. So it's a wide range. The other issues that we realize that human rights defenders have a positive, important, and legitimate role contributing to the realization of all human rights at all local, national, regional, and international level. They have been engaging with government and contributing to the effort in implementation of the obligation and commitment of the states. However, the current condition of COVID-19 pandemic indicates that there is a very extraordinary health emergency situation. So extraordinary measures are needed to, and this shown from the trend of spread of COVID continuing to increase in Indonesia, especially after the detection of new variants such as Delta. As of July 22, yesterday, based on the data from government COVID-19 Handling Committee and National Economic Recovery, there were 2 million, more than 2 million, almost 3 million positive confirmed cases, 549,000 active cases, 2,356,000 recovered, and 77,583 dead. The number of health workers who died reached 1,439. Capacity of hospital was getting fuller, so that it had impact on getting access to health services. The availability of medicines needed for COVID-19 sufferer is not evenly distributed and accessible. And according to the Indonesian Pediatric Association, at the end of June 2021, child mortality due to COVID-19 in Indonesia had become the highest in the world. And even Indonesia had become the #1 country in the world for daily positive cases of COVID-19 and the second highest number of deaths. So this is the reality we have. And challenges for fulfillment the right to health shall be based on 5 principles according to the international standard. The first is on affordability, availability, accessibility, acceptability, and quality. So allow me to share the realities of the right to health situation based on the result of a survey of public views on the right to health in the national health security system in Indonesia. The survey was conducted in 2020 in cooperation with Litbang Kompas, which is the research and development of Kompas Daily newspaper. So it is a reputable survey institution. The first aspect is about awareness and affordability. Indonesian people in general understand the right to health is human right, and the government is duty bearer to fulfill the right to health. Regionally, people in the western part of Indonesia are more likely to entrust health services to the government. In terms of education, confirming that the higher the education, the knowledge and demands that the government bears on the obligation to fulfill the right to health will be. But that means they also understand and perceive that there are people who also think private sector is also a health service provider. The obligation to pay monthly fee of BPJS or Social Security Administrator is considered a burden for some communities such as low income, people with disability, and layoff victims. The social economic condition of community affect the health service received by community. The issues of healthcare administration ignore the essence of health as a human right. So this is the situation that administrative procedure become the burden and become or ignore the essence of health as a human right. During COVID-19 pandemic, many workers were laid off. This had implications for the BPJS contribution that were in arrear or stopped due to no income. Therefore, enjoyment of health service as human right will also be disrupted, reduced, or not maximized. The problem of people who do not know how to register to BPJS health services is also one of the important points that need to be considered by implementing the national social security system in Indonesia. Government is obliged to guarantee the right to accurate and fast information for all people regarding health service. In this case, the government, the responsibility of implementing national social security system need to pay attention to and consider the social economic aspect of the community so that everyone can continue to enjoy the right to health services properly. The other aspect is about accessibility. The survey was conducted all over the country in all provinces with region from cities to the suburb. In the context of right to health as human right, the administration of BPJS services actually reduces or hinders everyone from getting health service. The right to health is a human right. However, right to health is contextualized in BPJS services. It should not ignore vulnerable groups or groups of people with low economic income. Emphasize that BPJS administers everyone right to health, so it should not be an obstacle to the fulfillment of the other right. Okay, acceptability. Regarding the participants of penerima bantuan iuran or recipients of contribution assistance, this is a government program. 60%, 61% of the respondents stated that they were not on target. This means there is a need for fundamental improvement related to the selection mechanism and provision of contribution assistance to the community in the service of right to health. Contribution assistance recipients should be the poor and needy people participating in the social security program whose contributions are paid by government according to provision of law number 40 of 2004 concerning national social security system. So we have several government regulation that support this service. Right to health is a human right which the government has the responsibility to fulfill, respect, and protect. BPJS is an institution formed to administer health insurance program in Indonesia. However, with the obligation to pay BPJS contribution, it makes health seems like an obligation, even though health is a human right. The issue of health right is that human rights are a problem in BPJS system, because they view that the right to health is only limited to administration. The third aspect about accessibility. Regarding access to health facilities, although 72.4% of respondents stated that it was easy to reach health facilities because most of the respondents are in the cities and suburbs. However, 19.8% of respondents stated that health facilities were not easily accessible. This is related to accessibility to community, to the existing health services, especially for vulnerable group. Accessibility here that needs to be considered is about transportation and transportation costs to reach health facilities. Assistance for disabled, the elderly, and children and other vulnerable groups, so that the enjoyment of health service can be maximized and not discriminatory. Lastly, about the quality and availability. In terms of quality of doctors, they are considered good, but there are still those who state that they are not good, still need to be improved. The availability and quality of drugs and equipment is still a problem. so the quality and availability must continue to be improved. The availability of health workers is still very inadequate in central and eastern Indonesia. This shows that there are still disparities in the right of citizens to get health service. Oh, lastly is about discrimination. As many as 55.8% respondents stated that the limited health facilities receiving BPJS help patients and complicated procedures. This is the complaint that is most often heard by respondents in BPJS health service today. This shows that community needs more health service than that can accept BPJS. So there are some places do not accept BPJS, especially the private hospital. And 19.8 respondents who experienced treatment discrimination or discrimination in obtaining BPJS services. We also look at the situation of people with disability or person with disability. The fact that the right to information on health service for person with disability is still not fulfilled significantly. 85% do not know about it. The state has not fulfilled its obligation to fulfill the right to information for persons with disabilities and their families. The state is obliged to provide more protection for people with disability who are entitled to receive BPJS, especially in Eastern and Central Indonesia. So that is the result of the survey that I share. And I'm stepping to the issues of human rights defenders. Komnas HAM focus on the issue of human rights defenders. For the year of 2020, we found there are violations, threats, and attacks against human rights defenders. There were at least 11 cases that reported to Komnas HAM. And in 2012, we also published a report. At that time, there was also around 11 incidents of violation or attacks against human rights defenders, include slander, unlawful of legal process, suppression of unions, assault or physical violence, dismantlement of activities, and shootings. Now, in regard to health rights defenders, I am lucky that I could interview the coordinator of Lapor COVID. Lapor COVID is a citizen coalition to report COVID-19. It formed by a group of individuals who are concerned about citizen human rights and public health issues related to the COVID-19 pandemic. This coalition was formed in early March 2020 when cases of COVID-19 broke out and were officially discovered. The link to this Lapor COVID is here. So up to now, they found there are threats experienced by Lapor COVID. 2 volunteers received intimidation from staff or head of service from the local government after Lapor COVID team helped reported a number of health workers in the particular district to disburse the incentive. In one area, 45 health workers have not received incentive since October 2020. And they also assist healthcare network, Indonesian Healthcare Network, who is alliance of doctors and other healthcare workers who hasn't received their payment also, incentive since November 2020. And they work together with Legal Aid Foundation and Legal Aid Foundation Jakarta and Indonesia because the problem is spread out all over the country. The last threat they found also from staff of one of the minister in Jakarta when they published in social media about the death toll, the different number. And they were asked, so they came to the office and explained why the number is different. They explained that the number is came out from the data from the provinces. So the data is calculated, and the person at the minister have a different number, and they feel threatened at that time, and those volunteers who are threatened are women. So it happened. So after sharing the situation, and now I would like to share about the human rights standard of norms and regulatory, or standard norma pengaturan, that prepared by Komnas HAM. We have already produced 5 of this SNP, and in the process of finalizing the last 2, and in beginning another 2. So there will be 9 at the end of this year. So standard of norms and regulatory is a breakthrough initiative of Komnas HAM in the absence of solid interpretation of specific human rights issues in Indonesia. Komnas HAM has been drafting the SNP since 2018 with full support from the government of Indonesia, particularly the Ministry of National Planning. Standard norm and regulatory is aimed to provide interpretation, assessment, and guidance on human rights principles in particular specific rights or issues or subjects. For example, we have freedom of expression, we have right to health, we have also on the elimination of racial, ethnic, and religious discrimination. The SNP is aimed to promote human rights norm based on international human rights principles and standards, and it applying universal principles into the national context. Human rights norms can be operationalized according to international human rights standards and principles, which taking the particular traits of Indonesian context into account. I think Pak Eko explained more detail earlier this afternoon. So about right to health. Health is a fundamental human right, indispensable for the exercise of other human rights. Every human being is entitled to the enjoyment of the highest attainable standard of health, conducive to living a life in dignity. The right to health in all its forms and at all levels contains the following interrelated and essential elements, the precise application of which will depend on the condition prevailing in particular state party. So health as a state, complete physical, mental, and social well-being, and not merely absence of disease or infirmity. So these are the main things. The core obligation on right to health is here. It's on our paragraph 66 of the SNP. We can, I think it mentioned also earlier by Pak Eko. And second is about the SNP on human rights defenders. We focus on this human rights defender, as I explained earlier, because of their strategic role in this promotion and protection of human rights. Human rights defender is a term used to describe people who, individually or with others, act to promote or protect human rights. Everyone, whether individually, in a group, or in organization, has the right to promote human rights. This right provides a role of the community to assist the government in carrying out its obligation in the field of human rights. Individuals, group, or organization that play a role in effort to protect, fulfill, and respect human rights. So there are several descriptions of human rights. Human rights defenders have the right to physical, social, economic, and psychological health, physical and psychological recovery, welfare, the opportunity to live in family, colleagues, and the environment. The guarantee is given by taking into account the condition and capabilities of the organization or institution of the particular human rights defenders. So there are interrelated provisions of these SNP of right to health and human rights defender. We realize that their affirmative actions aim to protect the enjoyment of the rights for vulnerable and marginalized or minority group is not a form of discrimination. The three main principles of right to health: non-discrimination, human dignity, and state responsibility. So the human rights defenders also has the right to health. So there are things that we can see here. State should respect, protect, facilitate, and promote the activities of human rights defenders and other members of civil society in order to assist vulnerable or marginalized groups to enjoy right to health. So now I come to the conclusion and recommendation. As I mentioned earlier, Special Rapporteur for Right to Health identified and stated clearly that government of Republic of Indonesia is on the right track toward realization of the right to highest attainable standard of health in Indonesia. However, there are various challenges that need to address comprehensively to ensure the affordability, availability, accessibility, acceptability, and quality of the realization of right to health. Although majority of Indonesia entrusts health service to the government, however, there are many Indonesians consider the important role of private sector as well. Thus, the role of private sector in health services shall further develop. Human rights defenders is important in promotion and protection human rights. However, their assistance is not fully recognized and protected in Indonesian legal system, as mentioned by Ibu Alimatul. Right to health defenders do exist and facing various threats. The information from Lapor COVID is evidence. They need to be supported and protected. Komnas HAM produced already standard of norms and regulatory, including on right to health and human rights defenders. This instrument recognized by the Ministry of National Planning and appreciated by many parties. So I recommend that it's important for all parties, state, private sector, academic, press, and all peoples, including students, to work together to develop a strong coalition to promote right to health condition, particularly to halt the pandemic COVID-19 and to achieve the highest attainable standard right to health in Indonesia. It is important to consider Komnas HAM SNP, sorry for self-promotion, on the right to health as elaborated translation of the highest attainable standard of right to health, which shall be referred by the government of Indonesia, private sectors, and other parties. It is necessary for a government to guarantee the protection of all rights, all human rights defenders, including right to health defenders, and promote policies for protecting and promoting their rights. Government need to speed up the process in preparing National Action Plan of Business and Human Rights, which include issues on the right to health and human rights defenders.